Projective testing. We throw something at you, we watch how quickly you react, duck, and get out of the way. Oh, wait, that's projectile testing. Oh, that's another podcast. Today we'll be talking about projective testing. Call in the psychologists. When we suspect that a youngster may have a severe emotional behavioral problem, we sometimes feel the need to conduct a psyche evaluation. A certified examiner administers various assessments. Typically, there's an individualized intelligence test, perhaps an achievement test that's individualized, and also individualized assessments to ascertain the youngster's psychological state. Is there intense anxiety present, depression, schizophrenia? We would also investigate the emotions and feelings that are behind one's personal actions. His or her perceptions of events, people, places. We get into the kid's private logic, private cognitive space. We also look for any other mental health or brain-based conditions. What are some other common instruments or procedures for evaluating one's psychological state, emotions, and feelings? Typically, we try to delve in to the inner self through the use of what is known as non-directive questioning. We're not leading the student in any way. We're probing, we're investigating, or else we produce what is known as ambiguous stimuli. We present the youngster with an image, with a picture, with an object, and ask the youngster to describe it, to talk about it, to tell a story about it. There is no right or wrong answer. There is just this object or stimuli. Well, some of the common procedures are to interview the youngster after having established rapport and ask those non-directive questions and engage in some active listening. We might present, in the way of ambiguous stimuli, incomplete sentences. I don't like it when people, and we allow the youngster to finish that sentence. Through the asking of many sentences, we may see some themes, some overriding, commonly found answers that give us insight into the youngster's inner self. And then we might engage in some of that presentation of ambiguous stimuli in our projective testing. It's important to recognize that the certified person, most often a psychologist, who is administering the projective test has been highly trained in their use and administration and interpretation. It is through these tests that we attempt to delve into the unconscious, the subconscious. These investigators believe that they can explore below the surface behaviors and conversations that we include in our functional behavior assessment. These projective tests allow us to find the deeper drives for a behavior pattern. We discover things we wouldn't otherwise find out through our usual procedures involved in a functional behavior assessment. Or if we have gathered our information and have suspicions, these tests can help to verify them. Here's the theory behind projective tests. They are based on psychoanalytic models of personality, finding its path all the way back to Sigmund and Anna Freud. There's the belief that the personality is governed by unconscious sources, not recognizable to us in our everyday thinking. They are not conscious and apparent to us. These tests indirectly assess both the conscious levels of thought and the unconscious aspects of our personality. Typically, with the projective test, the child is presented with 10 ambiguous, meaning there are no clues as to a correct response, 10 ambiguous images, and the person is asked to interpret them. The tests supposedly tap in to the person's deep unconscious to reveal the repressed, the not recognized, not conscious aspects of our personality. So a person looks at each of the 10 images and tells a story. The story might include what is on the large card right now that's presented. The person identifies the images. What's happening at that particular moment in that event that is depicted on the large card? What are the characters thinking? What are they feeling? What has led up to the event that we're being shown at this moment? And what's the outcome of the story? Ah, yes, a picture is worth 1,000 words. To better understand the principles behind the practices, let's look at Freud's conception of the human psyche, in which to use an iceberg metaphor, with 9/10 of the iceberg being below the surface. Our functional behavior assessment looks at the conscious level of the behavior and might delve a little bit below the surface into the preconscious. However, it requires projective testing to get into the deep unconscious. You see on this iceberg icon the superego, the ego, and the id. There is the belief in Freudian psychology that we are all born with one part of the personality, the id. The id says to us, do what you want when you want. Worry about yourself, satisfy your needs and your wants immediately. Somewhere around 1.5 years, 2 years of age, the superego starts to develop as parents engage in sleep training or toilet training. Society says to you, you no longer get to do things on your own schedule. Sometimes society's needs overrule your own. So think of it. Here you are, king or queen of the world. Everything revolves around you. And then comes toilet training. And the superego starts to develop the impositions of society, what we oftentimes refer to as your conscience. What does your conscience tell you? The rules and regulations of society. From the battle between the id and the superego comes the decision-making part of our personality, the ego. The ego is trying to decide what to do in a particular situation. Gosh, I want this right now, the id, but I'm not supposed to do that right now, the superego. And the ego tries to find some way of satisfying both, or decides which way to settle on the spectrum, which way to move. Some folks have a very strong ego. They are able to make rational choices, thoughtful choices. Other folks side more so with the id, just a little bit too much, where other folks are much too restricted in their decision making. They side too much with the super ego. We'll now end the first part of our podcast on projective testing, the one regarding the model, the principles, the theory behind projective testing. Please go now to part 2, where we'll be showing you the various projective tests that are sometimes administered to our youngsters.